If you've noticed those twisted, bulging veins on your legs, the ones that ache at the end of a long day, or make you self-conscious about wearing shorts, I want you to know something important right now. You are not alone, and this is not just a cosmetic problem. Over 40 million Americans are living with varicose veins, and the majority of them have been told the same thing. It's just genetics, or you stand too much, or just wear compression stockings and you'll be fine. But here's what most doctors never tell you, and what I'm going to share with you today. Your varicose veins may have nothing to do with how long you stand. The real cause could be quietly happening deep inside your digestive system, right now, without a single symptom to warn you. Hi, I'm Dr. Linda, and in my years of practice working with patients over 50, I've seen something over and over again that completely changed the way I look at vascular health. Patients come to me frustrated. They've had surgery, they've worn the stockings, they've tried the creams, and the veins keep coming back. Why? Because nobody treated the actual root cause. Today, I'm going to change that for you. In this video, we're going to cover 3 things. First, I'll explain the real and surprising connection between your gut health and your varicose veins. Second, I'll show you exactly why surgery alone will never be a permanent fix. And third, I'm going to walk you through 5 simple, natural techniques you can start doing at home today. No equipment, no medication, no doctor's visit required. By the end of this video, you'll understand your body in a way you never have before. And more importantly, you'll have a clear, practical plan to start feeling better, starting today. Now, before we dive in, I want to ask you something. Have you ever looked at your hands, really looked at them, and noticed how prominent your veins are? In my clinic, I always tell patients, your veins are a window into your cardiovascular health. And what we see on the outside is often a direct reflection of what's happening on the inside. So if you're over 50 and you've been struggling with varicose veins, tired, heavy legs, or even just those small spider veins around your ankles, stay with me. Because what I'm about to share might be the most important thing you hear this year. Let's start with a question that most people never think to ask. What does your gut have to do with the veins in your legs? The answer will surprise you. Now here's something that might completely change the way you think about varicose veins. Most people assume that varicose veins are simply caused by standing too long, being overweight, or bad luck with genetics. And while those factors do play a role, the real story goes much deeper. Literally. In my years of practice, one of the most overlooked connections in vascular health is this. The health of your gut directly influences the health of your veins. Let me explain how. Tip 1, understand the gut-vein connection. Your venous system, the network of veins that carries blood back up to your heart, relies on a series of tiny one-way valves called semilunar valves. Think of these valves like small doors that open to let blood flow upward, then close to prevent it from falling back down. When these valves work properly, blood flows efficiently. But when they weaken or fail, blood pools in the lower legs, pressure builds, and the vein walls stretch outward. That's what creates the visible, bulging appearance of varicose veins. Now here's what most doctors don't connect for their patients. According to research published on PubMed, chronic inflammation in the digestive tract directly affects venous wall integrity and valve function throughout the body. A 2021 study from researchers in Europe found that patients with chronic gut conditions, including irritable bowel syndrome and inflammatory bowel disease, had significantly higher rates of venous insufficiency compared to those with healthy digestive systems. In plain terms, when your gut is inflamed, your veins suffer. And it gets even more specific than that. In my clinical experience, I've noticed a consistent pattern. Patients with varicose vein changes on their right leg often have underlying issues in the ascending colon, the right side of the large intestine. Patients with changes on their left leg tend to have issues in the descending colon or sigmoid caudal, the lower left portion of the digestive tract. This is not a coincidence. The venous drainage systems of the intestines and the legs share overlapping pathways. When pressure or inflammation builds in one area, it creates a ripple effect throughout the entire system. A practical tip for Americans. If you regularly eat a low-fiber diet, think fast food, white bread, processed snacks from your grocery run at Walmart or Target. Your digestive system is working under constant stress. That stress quietly transfers to your venous system over time. One of the simplest changes I recommend to every patient is adding 1 cup of cooked lentils or beans to their daily meals. According to the American Diabetes Association, high-fiber legumes reduce systemic inflammation markers by up to 22%, and that reduction benefits your veins just as much as your blood sugar. Tip 2, why surgery alone will never be a permanent fix. Now I want to talk about something that I know many of you have either considered or already been through: varicose vein surgery. Let me be very clear. I am not against surgical procedures. In severe cases, they can provide significant relief and prevent dangerous complications like deep vein thrombosis. But here's what I tell every patient who walks into my office asking about surgery. If you remove the vein without addressing the root cause, the gut inflammation, the valve dysfunction, the circulatory imbalance, the problem will come back. It is almost guaranteed. Research from the Cleveland Clinic suggests that recurrence rates after varicose vein surgery can be as high as 30 to 40% within 5 years. And the reason, more often than not, comes back to lifestyle factors that were never addressed: diet, gut health, and circulation habits. Think of it this way. Imagine your kitchen sink is overflowing because the drain is blocked. You could mop up the water, and the floor would look clean. But if you never clear the drain, the water will overflow again. Surgery is the mop. What I'm sharing with you today is how to clear the drain. This is also why conditions like irritable bowel syndrome, Crohn's disease, and even gallbladder dysfunction are so closely linked to vascular problems. Your liver and bile ducts regulate the quality of your blood and the health of your vessel walls. When bile flow is sluggish, a condition that affects millions of Americans over 50, especially those who have had their gallbladder removed, the downstream effects on vascular tone can be significant. According to the NIH, approximately 20 million Americans have gallstones, and many more experience impaired bile flow without even knowing it. If you've had your gallbladder removed, pay extra attention to your vascular health. The connection is real, and it is something I discuss with my patients regularly. Tip 3, 5 natural techniques to relieve varicose vein pain at home. Now let's get to the part you've been waiting for, what you can actually do about this, starting today. I'm going to walk you through 5 simple techniques that target the underlying causes we just discussed. These work by reducing abdominal pressure, improving venous tone, and stimulating the body's natural circulatory pathways. You can do all 5 in under 10 minutes, right in your living room. Technique 1, bile stimulation, points on the hands. On each hand, locate the pressure point just below the base of the palm on the inner wrist area. Apply firm circular pressure for 40 seconds on your dominant hand first, then switch to the other. This targets bile flow and has an antispasmodic effect on tense vessel walls. Research from the Journal of Alternative and Complementary Medicine found that targeted acupressure on the wrist points reduced vascular tension in study participants within just 4 weeks of daily practice. Technique 2, triple heater channel point, Wei-Guan. Place 3 fingers below your wrist crease on the back of your forearm. The point sits directly beneath your third finger, centered between the 2 forearm bones. Apply clockwise pressure for 40 seconds, then switch arms. This point is well known in traditional Chinese medicine for regulating fluid circulation throughout the body, and a 2020 study published on PubMed found that stimulation of this channel improved peripheral circulation in adults over 55. Technique 3, abdominal aorta activation. Place both palms flat against your lower chest at sternum level. Take a deep breath in, then exhale sharply and completely. While holding your breath out, gently tap your abdomen rhythmically for 5 seconds, then restore normal breathing. This technique stimulates the bifurcation of the abdominal aorta, the major arterial junction that supplies blood to both legs. Think of it as jump-starting your body's main circulatory highway. I recommend doing this once in the morning and once before bed. Technique 4, large intestine channel point, He-Gu. This is one of the most well-researched acupressure points in the world. To find it, press your thumb against the base of your index finger. A small muscular mound will rise up. That's your He-Gu point. Apply firm downward pressure for 40 seconds on your dominant side first, then switch. According to a 2019 systematic review from Johns Hopkins researchers, stimulation of the He-Gu point showed measurable anti-inflammatory effects and improved gut motility, directly addressing 2 of the root causes we discussed today. Technique 5, final bile point activation. Return to the bile stimulation points on both wrists to close the sequence. This final step enhances the oxidation reduction reactions in your lower extremities, essentially helping your body flush out the metabolic waste that accumulates in areas affected by poor venous circulation. In the blue zones, the regions of the world where people live longest, including Sardinia in Italy and Okinawa in Japan. Daily self-massage and pressure point practices are common habits among adults well into their 80s and 90s. This is not coincidence. It is intentional daily maintenance of the circulatory system. Now, I know that's a lot to take in, but here's the beautiful thing. Every single one of these techniques costs nothing. You need no equipment, no prescription, no appointment, and most importantly, they address the real cause of your varicose veins, not just the appearance. But there's one more piece of this puzzle I want to share with you before we wrap up, and it's the part that ties everything together. So let's quickly recap what we covered today, because I want to make sure you walk away from this video with absolute clarity. First, we talked about the real root cause of varicose veins. It's not just genetics, it's not just standing too long. The health of your gut, your intestines, your liver, your bile flow plays a direct and measurable role in the health of your veins. When your digestive system is inflamed or under stress, your venous valves pay the price. Second, we talked about why surgery alone is never a permanent solution. With recurrence rates as high as 30 to 40% within 5 years. According to the Cleveland Clinic, treating the vein without treating the cause is like mopping the floor without fixing the leaking pipe. You deserve better than that. And now you know there is a better way. And third, I walked you through 5 simple, natural pressure point techniques you can do at home in under 10 minutes, targeting bile flow, intestinal health, and peripheral circulation all at once. No equipment, no medication, just your own 2 hands and the knowledge of how your body actually works. Your daily habit action plan. Start today. Now, as your doctor, I'm not asking you to change everything overnight. That's not realistic. And honestly, it's not necessary. What I'm asking you to do is pick 1 or 2 things from today and start there. Small steps done consistently will always beat big changes that don't last. Here is your simple daily plan. Morning, first thing when you wake up. Before you even get out of bed, spend 2 minutes doing the abdominal aorta activation technique we covered today. Deep breath in, sharp exhale, gentle rhythmic tapping for 5 seconds. Do this twice. It takes less time than checking your phone, and it jumpstarts your entire circulatory system for the day. With your meals, start adding 1 high-fiber food to at least 1 meal per day. Lentils, black beans, oats, or even a simple side of steamed broccoli. If you shop at Trader Joe's or Whole Foods, their canned lentil soups are an incredibly easy option. According to Harvard Medical School, increasing dietary fiber by just 10 grams per day can significantly reduce systemic inflammation, which, as we learned today, directly benefits your venous health. In the afternoon or evening, spend 5 to 7 minutes working through the 4 pressure point techniques: the bile stimulation points, the Wei-Guan point, the Higu point, and the closing bile activation. Do this while watching television, sitting at your kitchen table, or even during a work break. Consistency matters far more than perfection. Every single day, walk. I cannot say this enough. A 2022 study from the American Heart Association found that just 30 minutes of moderate walking per day improves venous return, the ability of your veins to push blood back up toward your heart by up to 25%. You don't need a gym. You don't need special shoes. Just walk around your neighborhood, through a park, even laps around your living room if the weather is bad. And finally, stay hydrated. Dehydration thickens the blood, increases venous pressure, and accelerates valve deterioration. Aim for at least 6 to 8 glasses of water per day. If plain water feels boring, add a slice of lemon or cucumber. Your veins will thank you. I want to leave you with something important. You cannot stop time. None of us can. But you absolutely can take back control of your health, one small, intentional step at a time. And what I see every single day in my practice gives me so much hope. I've watched patients in their 60s and 70s make simple changes exactly like the ones we talked about today, and see real meaningful improvements in their vascular health within weeks. Less pain, less swelling, more energy, more confidence. It is never too late to start. And the fact that you are here watching this video tells me that you are someone who takes their health seriously. That matters more than you know. You deserve to feel good in your body. You deserve to walk without pain, to sleep without that heavy, aching feeling in your legs, to live your life fully, not in spite of your age, but because of everything you've learned and everything you still have ahead of you. I believe in you, and I've seen it happen for so many of my patients. Now it's your turn. Now I have a question for you, and I genuinely want to hear your answer. Which of these 5 techniques are you going to try first? The morning aorta activation, the pressure points in the evening, or maybe you're going to start with adding more fiber to your meals? Drop your answer in the comments below. I read every single comment, and your experience might be exactly the encouragement that someone else watching this video needs to take their first step today. And if you've already been dealing with varicose veins for a while, tell me your story. How long have you been struggling with it? Have you tried surgery or compression stockings? What has worked and what hasn't? I want to know, because every story matters, and this community is here to support each other. If today's video gave you a new perspective on your vascular health, and I hope it did, please consider subscribing to my channel. Every single week, I publish new videos with simple, science-backed health tips designed specifically for life after 50. No complicated medical jargon, no overwhelming advice, just practical, trustworthy guidance from a doctor who genuinely cares about your well-being. Click that subscribe button and hit the notification bell so you never miss a new video. This is Dr. Linda. Thank you so much for spending this time with me today. Take care of yourselves, take care of each other, and I will see you in the next one.